teaching you how to apply emergency and pneumatic tourniquets. So first thing you want to do is put on some gloves. And for teaching purposes today, this is going to be a thigh. This is an emergency tourniquet, which is found in both of our trauma rooms. You want to take the tourniquet apart. Okay, so you want to pull the tourniquet to make a big enough loop to fit over the extremity. You have to place the tourniquet proximal to where the wound is. And then pull the tourniquet tightly. You don't want there to be any slack. And connect it with the Velcro strap. Next, you want to take out the windlass and leave all of the Velcro away from it. You're going to turn the windlass until you can't turn it anymore. This will stop the blood flow to where the wound is on the extremity. Once it's tight, secure the windlass into the securement device built into the tourniquet. Last thing you want to do is put the Velcro strap over it so it doesn't come loose, and make sure that you cannot palpate a pulse distal to where the tourniquet is. Lastly, you want to mark the time on the tourniquet and announce to the room that the tourniquet is on at what time, and you also want to document that in your chart. You're going to learn how to apply a pneumatic tourniquet. This is the pneumatic tourniquet machine, and this is one of the pneumatic tourniquet cuffs. You'll want to select the right size for the extremity that you're applying it to. In this case, we're going to use a 34-inch. First, you'll want to apply the protective stockinette over the extremity to protect the skin from the tourniquet. You want to make sure that there's no folds or creases. And you also apply this tourniquet proximal to where the wound is, or where the surgical site will be. So you'll just put the tourniquet around the wound, or around the extremity. So once the tourniquet is on and all set up, this is what it should look like. The tubing should be connected to the pneumatic tourniquet machine. Tourniquet should be on, secured, and the ties should be tied for securement. And you're ready to go. Okay, so this is the pneumatic tourniquet machine. This is used usually in orthopedic procedures for extremity surgery. So first you want to make sure it's plugged in, turn it on, and every time you turn it on, it'll calibrate. Here you can set the pressure. You can turn it up or down. We'll keep it at 250 for now. Hit the check mark. And you can also set a time for how long the tourniquet will be inflated for. Usually we do 60 minutes. And you can turn it up or down depending on the surgeon preference. Hit select. And the machine will alarm whenever it's reached the time limit, so you know how long it's been up, and you can also increase the time if you need to as well. here we'll set it for 1 minute just to demonstrate the alarm. To inflate it, you hit the inflate button. It'll go up to the set pressure of 250. And this machine regulates the pressure, so it'll always stay around 250 while it's inflated. So you always want to keep track of how much time is left on the tourniquet and just make sure that it's still at the set pressure. And whenever the alarm goes off or you're getting close to the end of the time limit that you set, you can just ask the surgeon how much more time that they would like on the tourniquet. So that's the alarm letting us know that we've reached our time limit of 1 minute. Say they want to increase the time by 5 minutes. Just turn it up, hit select, and the alarm will stop. Alright, and to deflate the tourniquet, you just come over, swipe down on the deflate button, and it will deflate and let you know whenever there's no pressure left in the tourniquet. At this point, you just want to notify the room that the tourniquet is down and at what time. So, if you're in a case and you deflate the tourniquet before the time has run out, and you have another case following, you always want to make sure that you reset the time, because otherwise, if you set it up with a new patient, it will just start over from the time that you were last using the tourniquet. So say we want to use it for another 2 minutes. We have to reset it for 2 minutes. So now it says we've been using it for 0 minutes and there's 2 minutes left.